Welcome to another episode of the Blessing Health System podcast, where we bring topics on health and wellness to the forefront. Today, we'd like to welcome Dr. Bill Severino to the discussion as we talk about testicular cancer, as June is Men's Health Month. Dr. Severino, welcome, and if you wouldn't mind, tell our audience a little bit about your medical background.
Good morning. Thanks for having me. My name is Bill Severino. I'm a board-certified urologist. I went to medical school at the University of Illinois. I did my residency at Springfield at Southern Illinois University. Practiced over in Springfield for about 21 years, and then have been here in Quincy for the last 3 years. So I've got about 24 going on 25 years of clinical experience.
Wonderful. Well, today we're talking testicular cancer. It's something that obviously is a big factor when it comes to men's health. And when we talk about testicular cancer and when we talk about men's health in general, a lot of topics usually center around middle-aged and older men, but testicular cancer really is kind of labeled more as a young man's disease and most often affecting men in their 20s and 30s. What's your initial message to men to pay attention to their health at a younger age and potentially catch something like testicular cancer as early as possible?
Yeah, the big thing with testicular cancer tends to be in younger men. I usually tell folks between 20 and 40 is kind of the wheelhouse. Occasionally you'll get it in very young kids or very old men, but again, the vast majority are in that age range. The big thing is if something doesn't seem right, it should be checked out. And one of the big things is testicular cancer happens to be very curable in most cases. And particularly the earlier you catch it, the better chance or easier it is to potentially cure it.
You talk about how testicular cancer is a very curable disease, and if you do undergo a successful battle against it, what are the chances that that cancer can return, and what does life post-treatment look like for a patient?
Yeah, one of the things with testicular cancer, even though it's not a super common disease, there's been a lot of good data and studies that have looked at treatment for that and follow-up for that. In fact, at Indiana University, that's kind of the world's biggest center for testicular cancer. And they've basically come up with protocols for follow-up for folks after treatment. And basically, if you follow those treatments, follow-ups, etc., once you get a certain number of years out, the chance of recurrence is low for that. So 5-10 years, if you've made it past that, chances are you're probably going to be cured from that.
You talked about regular checkups and things like that can really be the first step. For, a lot of younger men, we're used to athletics and school physicals and the old proverbial turn your head and cough type of situation. But when young men get into college and of course, when they get out of that and just into the normal workforce, for a lot of men, regular checkups, unfortunately, come few and far between. So if you're someone without a regular provider, you don't get regular health checkups, is there something you can kind of do at home? I mean, obviously, the first step is find a provider. But if that's something that's just not in your repertoire, what could you do at home?
Probably, at least with testicular cancer, probably the biggest thing for men is monthly self-testicular exams. Just examine yourself once a month in the shower, and if something doesn't seem right or different, then proceed to a primary care physician or provider. Again, that's pretty common. We'll see a lot of guys, they don't have primary care physicians, and they come in and what's been going on? Well, I found this, and they end up finally seeing somebody. So monthly self-exams, probably the biggest way that we actually find these things. People find them on their own for that.
What's a guy looking for? What are some descriptors? What are some feelings that maybe a guy should think, man, something's not entirely right?
Sure. Probably the biggest thing with testicular cancer is a lump or a solid knot on the testicle or swelling of the testicle. Common misconception is that, they'd be very painful. In general, most testicular cancers are not painful, and that often leads to delay in diagnosis because a young man will feel something that's hard and firm, doesn't hurt, they just assume it'll go away. They wait a couple of months, and then lo and behold, it's bigger and larger, and maybe this is something. Generally, I tell folks a painless, hard lump on the testicle that probably should be evaluated, or swelling, new onset swelling. probably should be evaluated by a provider with that.
For a lot of guys, when we talk about anything that impacts our genitals, anything below the belt, one of the first thoughts, especially that might affect a young man, is, man, how's this going to affect my sex life? How does this impact my ability to have kids? Sure. Can you go into a little detail about that and how testicular cancer diagnosis might impact those areas?
Sure. Two specifics there. One would be erectile dysfunction or function afterwards. In general, most men, it's probably not going to affect their erection quality in general, so they'll be able to get and maintain an erection typically. Fertility is another story, though. That can be affected with some of the treatment because of the potential for surgery, chemotherapy, radiation. However, one of the things we'll often do is if we find somebody with testicular cancer, we'll offer sperm banking ahead of time. If they're wanting to have children, just in case, say the chemotherapy makes them subfertile or infertile, or sometimes there's an abdominal operation that can affect the ability to ejaculate. So in those folks, we would offer sperm banking, but probably erection quality in general is probably not going to affect that a whole heck of a lot with treatment.
You just mentioned a few of the treatment options there in brief. Can you kind of go into a little detail about what are a couple of the most popular treatment options and what a man can expect if he has to go undergo that?
In general, if somebody has testicular cancer, almost guaranteed, the one thing everybody's going to get is the testicle will be removed. It's kind of like a hernia repair. Generally, we'd make an incision in the groin, remove the testicle. From there, it's pretty variable. In some patients with low-stage disease, now we may even do surveillance where they don't get any further treatment. They just get periodic scans, x-rays, blood work, etc. Some folks will require chemotherapy if they have more advanced disease. Occasionally, a small percentage may require or may be offered radiation therapy. Trend has gone away from that, though, so I don't see too many folks getting any radiation therapy. And then finally, occasionally, if there's men will require a major abdominal operation, what's called a retroperitoneal lymph node dissection, which is a pretty major operation for that. So. And it can also be the gamut. Some people will require the initial surgery, then chemotherapy, then the abdominal operation. So it can certainly vary.
You talk a little bit about in the procedures potentially removing a testicle, and that maybe being one of the more regular things that happen during that time. For a lot of guys, that's obviously a very touchy situation. Something that is very commonplace to you has been removed from your body. And of course, you can, that can impact things about how you feel in the bedroom with a woman or a partner or whatever. Can you talk a little bit about what prosthetic options are also available there that might give a man a little more confidence after he undergoes a procedure like that?
Sure. Certainly when you remove the testicle, you still leave the scrotum, the contralateral testicle. But down the road, if somebody is interested, they actually make penile prostheses where you can implant a prosthetic very similar, kind of looks like a testicle, kind of feels like a testicle. It's about the same size, and that can actually be implanted in the scrotum at a later date. Some people do it up front. Generally, we'd kind of wait till they're completed with their treatment to offer them that with that. So that is available.
From start to finish, what's the length of time from diagnosis to treatment to success? How long of a journey does a potential patient probably expect undergoing this?
That can vary. Again, sometimes just the initial operation to remove the testicle, that, a fair number of people may be cured with that alone. However, again, you do have to follow people for a lot of years to make sure there's no recurrence. Other people that have a more advanced disease, that may require months of chemotherapy afterwards and months of recovery. So it is quite variable for that.
You talk about maybe knocking it down at the source there at the testicle to remove. if it's not caught early, if it's not caught, what is the long-term ramification for the rest of the body? How does this spread, and what other organs can it impact eventually?
Yeah, generally in terms of testicular cancer, the first place it typically would spread is what's called the retroperitoneal lymph nodes. Basically, they're lymph nodes in the back of the abdomen. That's been in elegant studies pretty much shown to be the primary landing zone. But beyond that, if it's beyond that, it can really go anywhere. You can get it in the lungs, the liver, bone, brain, pancreas. It really can go anywhere. But those would be the major, the lymph nodes, the bone, or the lymph nodes, the liver, the lung would be the major players if it's spread with that.
A lot of our focus has been on younger men in this discussion. For guys that are 40 and up, how severe is this something to continue to think about? How often should you still be doing those regular self-checkups that you talk about? And what other warning signs for an older man might there be for this?
Yeah, certainly you can still see a testicular cancer in older men. It's just not going to be as common. Typically, the type we'll see in an older man tends to be less aggressive, but they can still have it, so probably still have monthly exams. You can actually get other disease processes that can affect the testicle as you get older as well. You can actually get a lymphoma or a leukemia of the testicle, which again would present in a similar fashion, swelling of the testicle, not necessarily painful. So it's still probably a good idea to consider monthly self-exams.
How much does family health history play into a testicular cancer diagnosis? Is it going to be something that if my grandfather was impacted by it, potentially I should be on the lookout, or is this something that is just kind of random between guys?
Yeah, probably not as big as family history, not a super critical part, probably doesn't markedly increase one's risk. If it does, it's probably minimal in terms of that, having a family history.
When it comes to certain cancers, smoking can play a huge impact. Other dietary habits, other lifestyle habits can play an impact. Is there anything that's ever been proven to have a real impact on a testicular cancer diagnosis that they've found, or anything that impacts that?
Probably in terms of the causation, probably not so much in that, but one thing that it probably does play a big factor in, if folks require chemotherapy, one of the chemotherapeutic agents that they use can cause a lot of lung toxicity, and if somebody's a smoker, that can definitely hurt their ability to tolerate the chemotherapy. So it's probably more important from a treatment standpoint as opposed to a causative standpoint for that. Plus, wound healing in general, smokers tend not to heal as well, so same thing with diet. Poor diet, people don't heal as well for that. But so not so much with causative factors.
If you're a wife, if you're a partner to a man, how much of a role does that play in reminding them, hey, you probably need to get a checkup? Hey, you need to check yourself out, because sometimes men are a little arrogant. Sometimes we're a little hard-headed, and the last thing we ever want to do is go visit a doctor. So for a partner in someone's life, what's that message to them to encourage their partner to get that checkup, to take a look and just kind of make sure?
Yeah, it's an easy thing to do. You can do it in the privacy of your own shower. It's not a big deal. Most people wouldn't even know you did it, so a little encouragement doesn't hurt anybody. It's a pretty simple thing to do, non-invasive, low cost, pretty simple thing. So a little gentle nudge on the shoulder is not a bad thing.
We always all need a little gentle nudge when we come to our own men's health. Dr. Severino, is there anything else in this discussion that we should probably let somebody know about when it comes to testicular cancer, or anything else that you'd just like to talk about?
Probably, when you mentioned about risk factors, what's the biggest risk factor for testicular cancer is probably having a history of an undescended testicle at birth, where the testicle has not come completely down in the scrotum. Now, most of those obviously are going to be picked up as an infant, as a baby, pediatricians, but that's probably the number one risk factor. And it used to be thought that even if you surgically corrected that by bringing them down, that would not change the risk of developing a testicular cancer. However, it would make it easier to detect. There may be some data that suggests that maybe by bringing it down, it may lessen the risk, but certainly having an undescended testicle is probably the number one risk factor. And that's something you were born with. So if somebody has a history of that, they're the ones that probably need to be on a little higher alert, just because they have a higher risk developing that.
Excellent. Well, Dr. Severino, we thank you so very much for your time today and all of your great discussion. If you'd like to learn more about testicular cancer and other options that we have here in treatment, you can visit our website online at blessinghealth.org.